We're about to begin. My name is Barbara Salkin, and I know most of you. And up here we have, my name is Barbara Salkin. I know most of you. And we have Ryan, who many of you might know from okay. We have Ryan from the Health Department, and he's going to be presenting. And we have Christine, our guest from GeneSight. So we're ready. We have a really good um, program for you this today. We're not at evening yet, and I'll just give you a few things. I'll just say a few things. Depression is a serious mood disorder that affects millions of people. Seniors are particularly affected by depression, and often don't get the help that they need or the help that would be most effective. Ryan sees people in the health clinic and often looks at people who have depression and makes various referrals. Today we're going to talk about a new process that's used for analyzing and diagnosing depression, and not diagnosing, I take that back, that looks at symptoms and refers for further information. So without further talking, I'll introduce Ryan, and he'll introduce Christine. And thank you all for being here.
Thank you, Barb. Barb, thank you for putting this together. I'm Ryan. You guys, some of you know me. I work in the clinic, the healthcare clinic. Christina is part of GeneSight, who I've been working with for a long time now. As a primary care provider and internal medicine, I come across one of the hardest conditions, as you guys know, and the most important is mental health and treating depression. These are problematic because it's often undiagnosed and often undertreated. And it doesn't take into the full account your genetic profile, things like how many medications we're taking, polypharmacy that's called, chronic disease. Not everyone just has one thing wrong. It could be a multiple array of conditions. So, and our bodies, as we get older, our metabolism changes, Your 40-year-old body is, different than my 80-year-old body, right? So, right. So, and in the past, and this is what you guys know, is that it was one kind of like a trial and error system where we really don't know. Providers, they kind of give you a medication for depression, and then they hope that works, and if it doesn't, it's a cycle. You wait weeks, you guys have side effects that you experience during that time, money, finances, things like that. Like, a lot of that can be frustrating, and then you have to start it all over again if it doesn't work. As you can see in the slide, that's biology. As our bodies change, we metabolize things differently. But new tools in the future, such as Christina and GeneSight, and I've now worked with them for over a year, and I've seen it firsthand. It's a technology that I think is the future of medicine. Some of the things that we talked about were metabolism. And if you look at this slide right here, these are some of the ways that we process medication. Our digestive system. Everything in depression is in the gut, in the GI system. So that's why sometimes when you're not feeling well, your gut can literally take on emotion and stress, and that can come out. But our digestive tract alters how medication is absorbed in the bloodstream. Other things like the liver and kidneys that are responsible for breaking down these medications that we use, and if they're working more slowly, then the medication is not clearing our system. It's staying in the body much longer than they need to. So this is where GeneSight comes in, because the future of, at least for antidepressant and medications for anxiety, it's a missing ingredient that we never had before. The ability to find in our genetic profile the different relationships between how your body works, something that may help you, one of you, may not be, right for the person beside you. That was something that we didn't take into account in the past, and GeneSight allows us to now utilize that tool. So basically, what we are going to talk about today, the two of us, is basically pharmacogenetics. It's understanding how our body DNA processes medications, and what that can do, and what that we hope that it does, is find the right medication that has the least amount of side effects and that is able to work in the body in the best way that it can. So this is just a quick basic thing on the test. It's a simple non-invasive cheek swab. I'll go to, and then it goes to a lab. But before we go to that slide, I made this one bigger for us. So this is really how we know what medication is the right medication. So it's not telling you that this is going to be the perfect medication, but what it does is it can tell you these 3 categories. Some of us are super metabolizers, which means no matter how much a doctor prescribes a dose of a medication, the body gets rid of it too quickly, and the medicine won't have time to work. If any of you have been on these medications, you may realize that after a couple years, even a couple months, you may feel that they're not working as well as they were in the beginning. And that's exactly because you're metabolizing it too quick. How does any provider know that? You don't. You need a test to show that. You could be too slow of a metabolizer. Then the medication builds up in the body. When these medications build up in the body, what happens? You get side effects. You don't feel well, and you can actually have more problems with your metabolism not processing the medication. There's higher risk of side effects. So the GeneSight test allows us to look for the right metabolizer. It will tell us in categories green, red, and yellow. Let's see if I have that. No. It's going to tell us the best medication for you based on your specific genetic profile, based on your each of us have different, I think they're genes that we analyze, GeneSight analyzes, that allows us to know which medication is the best. Here's a little graph of like a recent trial where adults that were over 65 used genetic testing to guide their prescriptions. In that trial, there was more benefit than with this actual genetic testing than the other standard care without it. You kind of understand that so far where we're going? Yeah. Any questions right now? This is just really background about the test. Yeah? Yeah. Here. It's not. I use. That was who was invited. Last year, I used a totally different company. It was called PGX Pharmacogenetics. I didn't feel like they gave me the right attention when it came to your guys' tests, because you have to understand, I'm not a biochemist. I had to learn what their test means. It wasn't until I met Christina that she took me to a meeting in King of Prussia, showed me a 3-hour presentation about every single possible thing that I needed to learn, the next day, dropped 30 different testing kits in my office so that I could begin right away. She has been able to answer every email and phone call, including the one that I made to her asking if she would please just come be here with me today. I tried to get the original people to come for about 4 or 5 months. They were too busy. They didn't really understand what we are here. I work for Curana, I do, but you guys have been like family to me. A lot of you I see all the time. For me, I'm going with the people that are going to be best taking care of the people that their health is in my hands. So if you're not going to be there for me when I don't understand something, I have to go with another company. So I'm sorry, there should be more choices here, but there already was. This is who wanted to be here today. Okay, thank you. Yeah. Okay. she does like you guys, and I think she's got munchkins, which I asked her to bring. Yeah. Yeah. Yeah, it's a lot of information. That's why the pamphlets are good. But really, the best thing to do is, if you're interested, is, if you come to the clinic, we can go over it one-on-one. And I've done this multiple times throughout the last 2 years, and I've actually seen where it makes a difference. I don't make a cent from GeneSight. I make nothing in referrals. These are strictly a tool that I'm utilizing because why not? It is offered. Medicare pays mostly. There's zero copay. I guess I can easily just hand medication out, but it's not the way I do it. I don't think the future of medicine shouldn't be not just for you guys, but for me. I don't want a doctor telling me that I have to try 5 different things until something's right if they can give me a little bit of background. Yeah.
At what point do you want us to talk to our doctor? I would think that would be the first thing.
Yeah, I'm speaking on I'm speaking on the people that I really see in the clinic a lot, and I notice when I do these that I don't always see the same people. Usually these are coming from people that I don't routinely see, and I would say talk to your primary care provider about it. I don't know if they offer the test. That's the only thing.
Well, I'm not saying for them to offer it, to give us feedback on whether we think this is worth doing.
Yeah, have you ever asked them?
No, I have, because I didn't know about it.
Yeah, that's what I'm saying. This is why we're here. I'm not selling. Yeah, we're not selling anything. This is for education. This is so you guys can go back to your primary care provider and say, I actually learned a little bit about pharmacogenetic testing, and I'm really interested. And a good provider should know a little bit about it. And if you can't get the test, then come see me. I'm here. I'm not going anywhere. Yes, Barb.
This is just one tool. When you go to your doctor, your primary doctor, and say that you're giving symptoms, and they might fit the description of depression, then this would be just one tool that you might explore.
Exactly.
Depression is a difficult thing to diagnose, but in the right hands of a knowledgeable provider, you can go somewhere with talking about depression. And did you want to talk about some of the symptoms of depression?
Yeah, I mean, do you guys know, offhand, what are some symptoms or unrecognized symptoms of depression? Do you guys know? Yeah. Can you defer questions? Yeah. Yeah, of course. Yeah, that makes sense. Okay, I'll get back to this then. Okay. So, all right, basically, the next thing that I was going to talk about was actually a case study from someone that I actually did treat. This was an 87-year-old female. She came in. I think I talked to you guys about this a while back. She was on Cymbalta for over a decade. It just was not feeling good about herself. She had very low energy, little pleasure in doing things. She was not wanting to do the things that she normally did, and she came to me. She wanted to talk about it, and this was one of the first times that I utilized this exact GeneSight test, and I basically told her what I told you guys today. This is what I know about the test. She agreed to do it. That week we did the test, and I sent it off to GeneSight, and under a week every single time. That's the other thing that I love about GeneSight. The old company, I'd have to wait 3 weeks. You guys would forget that you took the test. You would be like, when did I come there? Every time GeneSight gives me under a week, they email me personally to say, hey, it's ready. Go check the computer, which is great. Great. So we did that. I decided to do the test. She agreed to do the test, and we found out in the red category was her Cymbalta. She was what we talked about earlier, the poor metabolizer. I'm sorry, she was the super metabolizer. So no matter how much Cymbalta that she takes, and she's been on it for 10 years, a decade, no matter how much is going in her system, her body is getting rid of it way too quick, which makes sense because if you're taking it in the morning at 9 a.m. and it's out of our system at 11, how's that working for you? How's it working for a decade of, it's not. So we got the report, we came to the office and we looked at her options. We went over all the reasons why the Cymbalta wasn't going to be the best medication. Not that it wouldn't work, it just doesn't do it as effective as some of the other ones. So then we went and we looked at the green category, and she said, I heard about Wellbutrin, and I said, I think Wellbutrin is a good one. I think it's perfect for exactly what she needed. It wasn't, I was tailoring it specifically to her. It had a good side effect profile for her. She was also thinking about doing something for weight loss, and I said, right now, Wellbutrin has a side effect of a little bit of weight loss, so that's a good, instead of jumping to like the GLP-1s or whatever, why don't we try this? So we switched her and put her on Wellbutrin, and I would say that I have seen her in the last year easily every 2 to 3 months, and it's a new person that I recognize. And I use her as an example because she was the first person that I thought, I don't know enough to say if this test works or not, and now I've done it multiple times, and we've managed to at least 60% switch someone off of the wrong medication to a better one, whether that helped the side effects, if it helped the energy level, if it helped her mood, his mood. Those were all the things that it allowed us to do. And I still see to this day, and it's a new person that I look at. So it's a tool that we have. It doesn't replace clinical expertise. We're still going over every medication and what the right medication is as far as the disease process, but you're now being able to kind of precision tailor, personal tailor to your genetic profile. So we talked about this already. Okay. There you go. That's not her, but that's what she looked like. Yeah. No, she didn't. But she was very happy. And like I said, this is something that, yeah, it's all they allowed was clip art. She's cute though. I don't know. Yeah. So like I said, I'm here. I don't work for GeneSight. Christina works for GeneSight. I'm here to be an advocate for you. I'm always here, even if I don't recognize you. I recognize a lot of you. For the ones that I don't, I really hope if you ever do feel like you need to come up to the clinic, you feel comfortable. I love taking care of you. This is my specialty. This is exactly what I went to school for, to study geriatric and primary care, internal medicine. So this is right where I've now been working for a long time. I don't really have much more unless you have some questions on the GeneSight genetic test, anything that I missed out on. Any questions for sure?
Yes. My question is there genetic testing available for conditions other than depression?
So the question was, is there other, does it work for other than depression and anxiety? Is that what you were saying? Yeah, I heard you. Okay, awesome. In fact, this one is, and I believe you can correct me, it's for anxiety, depression, and some mood stabilizers. So you're thinking things like Seroquel. Those are like more kind of like.
Yeah. So there's mood stabilizers on there as well. There's tardive dyskinesia meds on there if you're any on.
Yeah.
Is that better?
Yeah. You gotta
Okay.
get close,
I was gonna say there's mood stabilizers on there. There's antipsychotics on there. There are so anything mental health related. So this is the mental health test.
Yeah, and I think there is one for like pain medicine, but that's not one that I've seen. Yeah. Yeah, the mechanics of the test. Great question. Great question. The mechanics are very easy. It's a swab, a cheek swab. So you're gonna do, I think, a couple slides back. Yeah, we'll show you here. It's a sample collection, a non-invasive cheek swab. They do each side for about 10 seconds. Put it into this envelope that Christina's company supplies. Already overnight delivery. It's already on there. I send it out. I usually get an email right away that it's been processed. And the next email I get, usually, I mean, unless it changes, it's been 5 to 7 days every time. They'll email me and send me an alert that it's ready to review. So that has been their promise to me when I originally kind of interviewed with her and the company. They promised that they would not make it as long as the other company, and she has every time. The test is a little bit difficult to read. I'm not going to lie to you. That's what, yeah, that's what, when we did the 3-hour like little mini conference on it, that is what I needed from Christina, because the other company kind of just let me get these results, and I didn't feel comfortable talking to you guys about results that even I was confused about. I understand them, but when you look at them, yeah, for sure. And you can even show like an example. I think it's in the, yeah.
So one recommendation that we do say is that we want your healthcare provider to read it because he knows, he's gone through all the training. And that's the one thing I will say about Ryan is he's really pursued in learning more about it instead of being like, oh, this is just like one more thing. He's really put in the time. And he's not embarrassed to say, hey, help me understand this better so I can help my people better. And I think that's vital because when you get the results, you don't want to misinterpret them.
Just move over.
Oh, sure. You don't want to misinterpret them because you can't change your own medication, right? You still need a script. You need the pharmacist needs the script. So that's why Ryan is so vital in doing this. Does that make sense? Yes. Okay.
So far it sounds like you've been talking about using this to assess people who are already on a medication. Is this something you would consider before somebody started their first ever medication?
Absolutely. Like, why not get right to the point? What are we giving an initial medication for that we already know might not work? And that way you do the test, then we can decide together our, the options, and that's the best part. Yes, Barb.
Depression is treatable, and it has to, although it takes a long time to treat depression, it's just not like taking an aspirin and the pain going away. Depression needs to be diagnosed, it needs to be attended to, and if you have several medications, you might take one for every 28 days to see if it has any impact, and then another one and another one to find out which one works. And the changes are usually subtle. You don't jump out of bed and say, I'm happy. There's a gradual increase in your level of satisfaction and so forth, of happiness. But depression is treatable, and it's often hard to treat, and it's often hard to diagnose because someone asked about the symptoms of depression. Does anyone want to comment on the symptoms of depression? What? Symptoms of depression?
Yeah, I mean, I can think of some. Yeah, I can think you got that. It's a feeling of a persistent sadness. It can actually come out also as frustration. It could be frustration. It could be not having mental clarity. It could be feeling like on the outside you're okay to other people, but knowing on the inside your body is tired. Maybe you're not eating. Maybe you have thoughts of hurting yourself or something that is very much needs to be addressed quickly. And we often hide from it. We don't really, we can fool ourselves sometimes thinking that we're not depressed. And that's not your age group, that's our age group and the age group below us and everywhere. It's right now, mental health is a very, very important, which is why I kind of felt that I could invest my time doing this today. And I'm technically not at work today. I wanted to be here because I think mental health is going to be in the future a huge part of this type of, especially this population. And I just wanted to be prepared for it. So this tool, you know, I don't, like I said, I've done it for a year. I've seen positive results, and I don't see anything negative. There's no harm. Honestly, I don't even think that Medicare charges for the test. Medicare or other insurances, they would rather you have the right medication the first time than to pay for 20 different medications and hospital bills. So it's a tool. It's offered here. I don't know a lot of places that do offer it. So your little clinic upstairs with me in it sitting there, you come up, it's there. It's waiting for you. I have them in my desk. I don't want it. I just want you guys to know that the clinic, whether you see a different provider or you see me all the time, I treat everyone the same. And I love seeing the familiar faces that I do take care of. It's like you guys have become friends of mine. So yeah, I just want you to know that we're here. There's really nothing about this presentation other than that I wanted you guys to have that information. And Barb was so great to set it up for us. So I'm here if you have more questions or anything. Yeah, she can talk all day.
Go ahead.
Given that there are a plethora of antidepressants available, will this test tell the analyst what medications to prescribe in precise terms, or just generalized?
So the question is, does the test precisely tell you which medication's gonna work? The answer is no. This is a guide in Ryan's hands to figure out whether he can change certain things like dosing, or if certain ones actually are gonna be able to work for you best. He's still the one who is going to diagnose you, and he has in mind already a medication. And based on that, he goes to the test to see, how can I make this med work the best for you, for your body, for your metabolism, like that. There's nothing out there yet that will say, this is gonna work, this is not gonna work. That's it. Science is not there yet.
It sounds like a job for a psychiatrist.
It's actually both, because folks like Ryan they start treating anxiety, depression before somebody even gets to a psychiatrist. So it's nice to catch this kind of stuff early before it escalates, if you will.
Yeah, it goes back to being underdiagnosed because, you know, not often is the psychiatrist your first stop. It's usually the primary care provider that you feel most comfortable with. That's how I know. I have, when people come in, they're comfortable enough to say, you know what, I'm not doing that well. Then you may have a psychiatrist your whole life, then he should know or she should know everything about these types of tests. But as far as what I see all the time, it was a worthy tool to have in our pocket, you know? And I feel like it goes back to like other things, like the metabolizing. A poor metabolizer, you may be okay on your medication, but it may be in your system too long. That could be why you feel tired, lethargic, or you're just sleeping all day. That tells me, like, if you like that Lexapro, if you like it, let's lower the dose, because that's a good medication for you, but your body is metabolizing it incorrectly. So it's not just like picking a new medication. Sometimes I'm lowering the dose, or let's take a lower dose at nighttime instead of the morning. Yes, Barb?
And talking about dosages, we don't take blood tests to find out if the antidepressant is working. So you have to find some guide to figure out what's working for you and what's not. It's not like they can measure your sugar level or blood pressure by some measuring tool. So that's why antidepressants are so difficult. And one of the things that brings people in to talk to their doctor often is the feeling of loss, and because as you get older, there are many losses that you suffer. And there are people losses, there are house losses, your garden loss, there are just many, many losses, and people feel very sad. And they go to a doctor and might say at the middle of a blood pressure exam, I feel really sad, I don't know what's wrong with me. And this is where the doctor or technician can tune in and find out what exactly is happening for that person and get more info. The best treatment for depression, research shows, is talk therapy and medication, both together.
Exactly.
I just want to confirm. You'd get the test, it puts you into one of the 3 categories, and that's
No, it actually
that's your result.
It actually does every medication, every antidepressant. It will analyze your specific DNA profile, genetics, against every antidepressant. So you'll see like a box, like I wish we have one we can pass around. I do, yeah. There'll be every medication, and they're going to be separated into different boxes. It'll be a green, yellow, and a red box. She'll show you. But yeah, it analyzes every single one of them. It's going to look like that. So as you can see, that's not just one medication. That's like 30 different medications, all when you do the next page too. So let's say that you were taking Lexapro, and you guys came in and it wasn't working, you didn't feel like yourself. We do the GeneSight test, and Lexapro comes up in red. There's a little number next to it. See how it says 1, 4, and 8? That goes to the clinical consideration, which helps me analyze why that is coming up in the red category. It may say that there's the level is way too high for you or way too low. That's how I'm able to interpret it. And when it comes up in the red category, I always change it, because there's no point in keeping that type of medication on when you have all of these in the green that, based on your specific genetics, are what they think is the best option for you.
So I'm still confused. You said they don't say this is for you, this is not. This is like you're giving which medications are for each of the 3 categories. I think I'm confusing that with the 3 categories you showed earlier, which is slow metabolism, fast metabolism.
Yeah.
These are
Exactly.
different. 3 different ones.
Right. These are those were just telling you about what could be analyzed in the test.
It could be.
Could be. Yeah, those are just options that could be. This is telling you that if you take one of these, if you're taking Cymbalta, that in your profile, you don't have a slow metabolization or a rapid one. That's actually saying go. That's a good one to choose right now. But if you said, well, my friend told me about Zoloft, then I can be like, well, Zoloft is in the red category, because again, according to the genetic test, it says that maybe you're a rapid metabolizer of it, so you're never going to get the right dose. It's never going to work throughout the day.
Okay, so these results are for just you.
Yeah, they're
Okay.
just for us, and that's what we go over when you guys come in, when we review the test. We go like, let's look at all the ones in green. Sometimes they like one they'll like one in yellow, and I'm like, okay, that's not bad. That just says, we have to keep in mind that it could cause some issues, but it's not the worst one to take.
Does it also take into account other medications you might be taking? Does it show interactions at all?
It doesn't, yeah.
No, it doesn't. So that is exactly why you need Ryan. Ryan has been trained in how to read this. That's why when you had asked that question, is it like easy to use? It does look simple to read, but Ryan has been trained on how, if he needed to use those other medications in the yellow and red as well. They're just more tailored to the actual patient. So your test is going to look different than your neighbors, than the neighbors, than the neighbors, than the neighbors. And that's where Ryan comes in, because he's like, all right, based on what you told me, based on what we're on, also based on the blood pressure medications and statins you're on and everything else, this is what we're going to do, and this is why.
Yeah, we'll do a comprehensive review at that. When we get that back is when I review with you every medicine you're on and making sure, like I do work before you guys get there so I can say that your lisinopril, the blood pressure medication, it's not going to get in, there's no interaction if we chose this one. And that's where the best part is, because you know, if you just look at that and pick one, that's fine, but you still need somebody that's going through. Like I said in the beginning, we don't all just have one thing wrong. We have multiple things. And, you know, some things you can't take with other medication. And that's not for you guys to really know. It's for a medical provider. That's why we're here. So, yeah, that's how the visit would go to review it.
Speak, somebody. Anyone else? Carry on.
Yeah.
What's the format? Let's say I want to discuss a medication with you.
Sure.
I can hear.
I don't want to talk. I don't want to talk.
Again, I think so. Yeah. Surprise kid.
The hypothetical case.
Put it in your mouth, yeah.
Now to your mouth, that way.
This way?
Just like you were gonna lick it. Like you were gonna eat it.
Too many teachers here.
This way?
Excellent.
Great. So here, the hypothetical case is I want to see Ryan. I want to discuss a medication that I'm taking with him. What is the procedure? Do I just call Libby and say I want to talk to Robin?
Yeah, yeah, of
Robert?
course.
Ryan?
It's always been that way. Well, Robin, I don't know who Robin is.
I'll see Robin
Yeah, he's
instead,
prob-
then forget
she's
about
probably-
it.
She's better looking than me.
Yeah, right.
Yeah. Yeah, it's always been, you know, it's always been that way.
Okay.
You can come up anytime. Yeah, just call Libby and they'll get you an appointment. The only thing is if you haven't seen me before, you just have to sign the consent that I'm allowed to see you. But from that point, that's it. It's not hard.
I have another question. Could you please define gene-drug interaction?
Yeah.
Oh my God.
So what that's saying is that your genetic that we're looking at, it's called, I think, cytochromes is what it actually, it goes a lot deeper than this, which is why I didn't want to confuse you guys, but it looks at your cytochromes, and in those cytochromes, they tell you which of those interact with different medications. That's what it's analyzing. This is going into a system that's analyzing every medication versus your genetics and to see which is the best one for, not the best one for you, but which one has the best chance of working. Yeah, like it's not telling you that this is the miracle green, but it's telling you, but there's a lot more issues with the red and even the yellow. So it's basically just saying that the genes are not, the interaction between the gene and the drug is not the best one for you. It would not probably be the best one for one of those reasons that we were talking about. Yeah.
I apologize, I got here late, so this may have been covered. What about who gives us the original diagnosis that we need medication, that we are actually depressed instead of just out of sorts?
Yeah, of course. That's a great question. When you come to me and we're discussing that, we're taking a couple different tests in the actual clinic, but I work side by side also with the psychiatrist up there and the psychologist, Talia, who was great. So usually if we're going to start new medication, I always talk to them about the case as well. And whether it's them coming to me asking about, you know, the psychiatrist may say, I think I want to start Wellbutrin. Do you think that's a good one? Or I'm doing that, asking him. So we kind of collaboratively agree, sorry, it's been a long day, to start treatment based on just, you know, the person and based on if their genetic test is being looked at and your other medications and things like that. Primary care providers, psychiatrists, they're usually, like we said before, a lot of the times primary care providers are the first line of, oh, I always wanted to do this. I always used to get in trouble when mine would go off.
It's maintenance. Maybe we all got one.
I didn't bring my phone.
A good measure about when to go to a professional to ask about help for your mental health is if it's lingered on for 2 to 3 weeks. You know how you feel on a lousy day, that you feel miserable. But if that goes away and it just happens again in a month or two, then you might talk about that. But when it lingers for 3 weeks, you need to go for some help because it's longer than just a bad day. So keep that in mind when you're looking at your own mental health.
Exactly. And I'm going to leave this up front. This is just like a it's basically a patient health screener. If this something you're filling out, if it seems like you are, you know, filling this out and you think that you might need help, just come see me. Bring this to me and we'll talk about it. This kind of makes it easier to gauge and be honest with yourself. I know, like, we all try to kind of say we're great on the outside. You know, it's like we can get really good at doing that. But everybody needs help. Every single one of us, no matter what age we are. And Christina and I, we're just here as another tool for you guys because, yeah, we're here. So I'll keep this up here. If you have any other questions, if not, you guys see me anytime you want. And thank you for coming. It shows a lot about your mental health that you guys came here today. That's really nice of you. And thank you, Barb, for having us. And yeah, okay, thanks.